Knock, knock.
Come in.
Hi, my name is Matt. I'm going to be your nurse today. How are you doing?
Good.
Great. Before I do anything, I just want to wash my hands and perform some hand hygiene. Wash your hands, prevent the spread of infection. So today I'm going to be performing a physical assessment on you, all the way from the top of your shoulders, all the way down to the bottom of your feet. And I just want it to be known that any and all information that I obtain today will be documented and logged directly into your electronic health record. And that information is going to remain completely and totally confidential. Nobody has access to it at all except for me, because I'm your nurse, any healthcare provider that may be providing care to you, as well as yourself, because you are the patient. So let's get started. I just want to start by making the room a little more private. Shut this curtain. How are you feeling? Do you feel that the room is private enough?
I do, yes.
Are you comfortable?
Yes.
Do you feel safe?
I do.
Is the room temperature okay?
It is, yeah.
Do you need anything? Water before we get started?
No.
Fantastic. Let's get started. So I'm going to start by taking a general survey on the patient. And it should be noted that for the purpose of this assessment, blood pressure will not be taken, but I will start by taking the patient's radial pulse for 30 seconds in order to calculate their resting heart rate. So if I could just have your wrist, please. Great. I'm going to take this for 30 seconds. Ready. Fantastic. Radial pulse is 32. 30-second radial pulse of 32 multiplied by 2 is a total resting heart rate of 60 beats per minute, which is completely and totally normal. That is within the normal range of 60 to 100 beats per minute. Now, I just want to quickly assess the skin that you have exposed. Now, just taking a look at your skin, I don't see any abnormalities. The skin looks completely and totally intact. No bruising, no lesions, no abnormal redness indicating any sign or symptom of rash. It should also be noted that when the patient first walked into the room, their gait was completely and totally equal bilaterally. Now, I just want to assess your level of consciousness. Couple quick questions. Can you confirm where you are for me?
In an appointment with Nurse Matt.
Who am I?
My nurse.
What is today's date and time?
December 2nd, about 6 p.m.
Fantastic. So the patient's level of consciousness is intact and unaltered. They have an adequate level of consciousness. Also, it should be noted that the patient's facial expression in regard to the current environment or situation that we are in is completely and totally normal. No signs of distress, no signs of discern. The patient's facial expression matches the current environment that we are in. So now let's move into the assessment of your neurological system as well as your musculoskeletal systems. A couple quick questions. Do you have any muscle pain?
No.
Any joint pain? Any loss or decrease in vision recently?
No.
Fantastic. So let's begin. I'm going to begin by assessing the patient's eyes, specifically their pupils. And an acronym that I will be using during the assessment of their pupils is PERLA. Now, what PERLA stands for? Well, the acronym: P, pupils, E, equal, R, round, R, reactive or reaction, L, light. So P, pupil. Are the patient's pupils present? Can I physically see them? Are they intact? Are there any abnormalities with them? Are the pupils equal in size and shape? R, are the pupils round in shape? Do they appear clear, perfectly normal, round shape? R, the second R, reaction. Do they react to light? I will be testing that by using my pen light. So what I'll be doing is I will be shining a light into the patient's eye. The eye that receives the light, there should be a direct light reflex, which means that the pupil will constrict. A simultaneous reaction of the pupil that is not receiving light will be a consensual light reflex. So in order for that test to be considered normal, we want a direct light reflex as well as a consensual light reflex, and then I will be testing the patient's accommodation by holding my pen directly in front of their nose and bringing it slowly closer to their face. I will instruct them to constantly maintain gaze on the pen, their gaze on the pen, and the appropriate response is conversion of the pupils as well as constriction. So let's begin the assessment. So, P, the patient's pupils are present. They are completely intact. I'm able to see them. They are normal. E, equal. The patient's pupils are equal in size and shape. R, the patient's pupils are completely and totally round. They are perfectly normal round shape. L, light. No, I'm sorry. R, reaction. Well, the R and the L go together. Reaction to light. I'm now going to test the patient's reaction to light. Could you just focus on that back wall for me, please?
Yeah.
I'm going to come in at a side angle with my pen light and shine my light directly into your right eye.
Sure. Oh, sorry.
Fantastic. So we have a direct light reflex in the right eye as well as a consensual light reflex in the left eye. Now I'm going to test the other eye. Focus on that wall. Fantastic. Direct light reflex of the left eye and a consensual light reflex of the left eye. Now I'm going to test your pupil's accommodation. Just focus your gaze on my pen. Fantastic. So proper accommodation is noted. The patient's pupils did constrict and converge. I am now going to test the patient's muscular strength as well as their muscular function within their upper extremities. So if you could just grasp my hands
Sure.
and squeeze.
Okay.
Fantastic. Palms up.
Okay.
Resist my pressure.
Okay.
Flip your hands. Resist my pressure. Fantastic. Arms like this. Resist my pressure. So it should be noted that the patient's muscular strength as well as their muscular function within the upper extremities of the body are present, intact, and equal bilaterally. Shoes off, please. I'm going to now test the patient's muscular strength as well as their function within the lower extremities of the body. Other shoe.
Okay.
Feet up.
Okay.
Bend your knees. Perfect. Resist.
It's a rolly
Perfect. Okay. So the patient's muscular strength as well as their muscular function within the lower extremities, it should be noted, it is equal. It is equal bilaterally as well as intact. No issues there.
Great.
So these would all be expected findings within an adult. However, within an older adult, the expected findings might be decreased muscle mass, decrease in muscular strength, kyphosis, osteoporosis, potentially decrease in vision or a loss in vision. And also it should be noted that the assessment of the patient's eyes, their pupils were totally and physically intact, appeared normal, and the neurological function of the pupils were completely intact and normal. Okay, so now we are going to move into the assessment of the respiratory system. And before we begin, a couple quick questions.
Sure.
Do you have trouble breathing?
No.
Do you ever have shortness of breath?
No.
Do you ever have pain when you inspire or expire?
No, I don't.
Fantastic. So I'm going to now listen to the patient's lungs. I'm going to start at the second intercostal space, listening to the right upper lobe as well as the left upper lobe. I'm then going to move down to the fourth intercostal space where I will be listening to the right middle lobe and the left upper lobe. I will then move down to the sixth intercostal space where I will be listening to the patient's right lower lobe and their left lower lobe. I'm going to listen to their lungs anteriorly and posteriorly.
Wow.
Okay.
Just. Sorry.
Breathe in through the mouth and out through the nose. Fantastic. Now I'd like to listen to the posterior, so if you could just turn for me.
Yeah. Sorry.
Okay, fantastic. In through the mouth, out through the nose. Good.
Okay.
In through the mouth, out through the nose. In through the mouth, out through the nose. In through the mouth, out through the nose. Okay, fantastic. So, upon listening to the patient's lungs anteriorly as well as posteriorly, it should be noted that their lungs sound completely clear and equal bilaterally, please. No crackling was heard, no wheezing was heard, no noises indicating any fluid within the lungs were heard. Fluid within the lungs could indicate signs of pneumonia or potential signs of infection. So now I'm going to I'm going to assess the patient's respiratory rate. How I'm going to do that is I'm going to just simply watch them breathe for 1 full minute. So in through the mouth, out through the nose, 1 full minute. Keep breathing. Okay, fantastic. So it should be noted that the patient's respiratory rate was 15, which is completely normal and is within a normal range because the normal respiratory rate range is between 12 to 20 breaths per minute. Now, that is going to conclude the assessment of the respiratory system, and these were all findings to be expected within an adult. However, within an older adult, you might see poorer gas exchange in the lungs leading to a decreased ability to tolerate physical activity. You may see a decrease in tidal volume within the lungs. Also, you may see dyspnea or tachypnea in an older adult's lungs. That is going to conclude the assessment of the lungs. We are now going to move into the cardiac assessment.
Okay.
Couple quick questions. Do you fatigue easily?
No, I don't.
Do you experience chest pain?
No.
Do you experience chest tightness?
No.
Fantastic. So I'm now going to listen to the patient's heart at different positions. So I'm going to start with the aortic valve at the second intercostal space within the right sternal border. I'm then going to move over to the pulmonic valve within the second intercostal space within the left sternal border. I'm then going to move down to Irv's point at the third intercostal space within the left sternal border. I'm then going to move down to the tricuspid valve at the fourth intercostal space within the left sternal border. I'm then going to move down to the mitral valve, listen to the mitral valve at the midclavicular line. I'm going to do this with both the diaphragm as well as the bell of my stethoscope.
Sure.
All right. Bless you.
Sorry.
Diaphragm of my stethoscope. No. Aortic. regular rate and rhythm. Pulmonic, regular rate and rhythm. Irv's point, regular rate and rhythm. Tricuspid, regular rate and rhythm. Mitral, regular rate and rhythm. Now I'm going to do the same thing with the bell of my stethoscope. Aortic, regular rate and rhythm. Pulmonic, regular rate and rhythm. Irv's point, regular rate and rhythm. Tricuspid, regular rate and rhythm. Mitral, regular rate and rhythm. All heart sounds using the stethoscope, the bell of my stethoscope, as well as the diaphragm of my stethoscope, were totally and completely intact, normal, no signs of cardiac dysrhythmias. All points of the patient's heart demonstrated a regular rate, as well as regular rhythm. So now what I'm going to do, I am going to take the patient's apical pulse at the midclavicular line, listening to their mitral valve for 1 full minute.
What's that?
Patient's apical pulse at the midclavicular line is completely and totally normal, and your apical pulse at the midclavicular line within the mitral valve was 78. So now, that is going to complete the cardiac assessment. All these findings were expected findings with an adult. However, within an older adult, you may expect to see hypertension, cardiac dysrhythmias, decreased cardiac output. An older adult may not be able, their heart may not be able to keep up with the exertion effort of exercise. So that is going to complete the assessment of the cardiovascular system. I'm now going to move into assessing the patient's peripheral vascular system.
Okay.
Do you ever experience swelling within your extremities?
No, I don't.
Do you ever experience pain within your extremities?
No,
Do you have a history of vascular problems or vascular contraindications?
I don't.
So I'm going to begin by assessing the patient or inspecting the patient for varicosities on the skin. So it should be noted, no varicosities are seen. Varicosities are varicose veins, and varicose veins are veins that are extremely visible.
Mm-hmm.
They essentially protrude from the skin. They're caused by a high amount of blood pressure within the veins. No varicosities, which is a completely and totally normal expected response.
Mm-hmm.
I am now going to assess the patient for any signs of edema. And looking at the lower extremities, looking at the upper extremities, there are no signs of edema. The skin within the lower extremities is completely clear and intact. No edema, no signs of skin pallor, no signs of cyanosis, I don't see any excess moisture within the skin, which is fantastic. So I'm now going to palpate the patient's lower and upper extremities, assessing their temperature. The patient's temperature is equal bilaterally, totally normal. Lower extremities.
Okay. Lower the camera. Our hands are very cool.
Patient's temperature within the lower extremities is completely and totally normal and equal bilaterally. Now I'm going to assess the patient's capillary refill. Hold on.
Sure.
Patient's capillary refill within the upper extremities returned within 2 seconds, which is completely and totally normal. Shoes off, please.
Sure.
Cool.
Sorry.
I'm now going to assess the patient's capillary refill within the lower extremities. Fantastic. Should be noted that the patient's capillary refill within the lower extremities returned also within 2 seconds, which is completely and totally normal. There are no signs of peripheral artery disease, and there are no signs of decreased perfusion to the extremities. I am now going to assess the patient's pulses. I'm going to palpate their radial pulse, their pedal pulse, and their posterior tibial pulse. Arms out like this.
Okay.
Radial pulses are present and equal bilaterally. I felt both of them, and they are at a grade of +2. Shoes off, please.
Okay.
Pedal pulses. Both are present and equal bilaterally at a grade of +2. Feet
Oh,
up.
I'm sorry.
Posterior tibial pulses behind the right here, the side of the ankle. Both are present and equal bilaterally at a grade of +2. That is now going to conclude the assessment of the peripheral vascular system. These are all findings you would expect to see within an adult. However, within an older adult, you may expect to see arteriosclerosis, decreased blood flow to the lower extremities, as well as edema within the lower and upper extremities. So now we're going to move into the assessment of the GI system. Couple quick questions.
Sure.
Any difficulty swallowing?
No.
Any abdominal pain?
No.
Any recent changes in appetite?
No.
Fantastic. So I'm now going to assess your abdomen. For the purpose of this assessment, the patient won't leave their shirt on. So looking at your abdomen, I do not see any bruising, no lesions, no abnormal redness. Also, it should be noted the patient's abdomen is completely and totally symmetrical, as well as there are no signs of discoloration within the abdomen. So now what I'm going to do is I'm going to auscultate your bowel sounds, and I'm going to do this starting in the lower right quadrant, working my way in a clockwise motion, ending at the lower left quadrant.
Your face.
Doesn't matter. Lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. So, bowel sounds should be noted. They are present. They sound completely and totally normal. They are intact. Patient has completely and totally normal, intact bowel sounds. I'm now going to percuss your abdomen.
Okay.
I'm going to move in the same clockwise motion and start in the lower right quadrant.
Okay.
Hold your,
Sure.
just like that. I did not hear or feel any abnormalities upon percussing the patient. I am now going to lightly palpate the patient's abdomen, moving in the same exact motion, starting at the lower right quadrant. Do you feel pain? Did you feel pain during this?
No, I don't.
Fantastic. And I did not feel any abnormalities, no tenderness, no masses, no lumps, nothing that should be taken really into consideration. And the patient felt no pain.
No.
Now I'm going to deeply palpate the patient's abdomen, moving in the same clockwise motion, starting at the lower right quadrant.
Okay.
Any pain?
Nope.
No pain?
No.
Fantastic. Patient had no pain. And again, I did not feel any abnormalities whatsoever. No tenderness, no masses, no lumps, nothing that should be taken into consideration. I'm now going to check your skin turgor. You could just...
Okay.
I'm not going to take the patient's
No.
shirt off.
Okay.
Or fantastic. So skin turgor is completely and totally normal, completely intact. No signs of dehydration or deficient fluid volume. That is going to conclude our physical assessment from the top of your shoulders all the way down to the bottom of your feet. Do you have any questions for me whatsoever?
No, I don't. Thank you so much.
Great. Everything went to your liking today?
Yes, it was wonderful.
Great. And now again, all of this information is going to be directly documented into your EHR. That information will remain completely and totally confidential. I'm your nurse. I'll have access to it. Any physician that provides care for you today or in the future will have access to it. And you will, of course, have access to it.
Thank you.
Other than that, under the laws of HIPAA, your information is completely and totally confidential. Let me just wash my hands before I leave, prevent the spread of infection. Open up this curtain. You have a nice day.
Thank you.